Well, if you've been paying attention, you've probably seen this doctor named Brian Ardis. He's really been bringing a lot of attention to nicotine, apparently, on the internet. So, of course, I get a lot of questions. I have a clinical practice and I've got a lot of patients, and they're interested in nicotine. What can it do for them? Is it healthy? Is it the bad molecule? Is it the bad compound and chemical that we should all be avoiding, which is going to kill us? Well, it turns out that there's, of course, nuance to this. Of course, nicotine is found in tobacco. Tobacco is one of the components of many cigarettes, and most cigarettes have a lot of carcinogenic or cancer-causing compounds, and understandably, we need to avoid those, especially in excess. We know that secondhand smoke definitely has effects on people as well. But if we just take nicotine by itself, we may have a different way to think about it. All right, so let's talk about nicotine. So nicotine is a molecule. It's naturally occurring. It's in many plants, especially a group of plants that we call nightshades. Now, as you well know, nicotine's been demonized for decades. Even in med school, we're taught about how bad nicotine is. But it turns out, as with many things, there are some caveats and nuance to this. What we found out is nicotine actually helps with inflammation, and it may even be neuroprotective. So, again, we're not talking about the cigarette kind of nicotine, but the pure compound. And so we're rethinking what its usefulness is. Now, we know nicotine is a stimulant, but it's more than that. It's called a cholinergic agonist. So it binds to receptors in your brain that regulates a neurotransmitter called acetylcholine. And these are critical for attention and learning. Studies recently from the Journal of Neuroscience show that it enhances cognitive performance, especially in non-smokers. It improves working memory by up to 20% in tasks like the Stroop test, which is a memory test. Here's the twist. It also decreases inflammation, which is important. A lot of chronic diseases have a very strong inflammatory component. Research in Nature Reviews Immunology highlights how nicotine activates alpha-7 nicotinic receptors on immune cells. And what that does is it dials back the pro-inflammatory cytokines like tumor necrosis alpha. That's why it's being trialed for ulcerative colitis and Parkinson's and other chronic diseases. Now again, nicotine addiction can be real. Nicotine use can spike dopamine, which we know is responsible for addictive behaviors. So we're talking about low dose, non-inhaled forms, preferably like a gum, a patch, or a lozenge under medical guidance. So if you're curious, start with 1 or 2 milligram doses in those forms to boost afternoon focus without that crash. So here's the takeaway. Nicotine may not be the villain. It can be a useful tool, especially when used wisely. What's your next biohack? Hit me up in the comments and let me know.